Welcome everyone to today's webinar, Rapid Rehousing for Domestic Violence Victims, a Formative Evaluation. My name is Susan Howley and I am the Program Director for the Center for Victim Research. This webinar and all of the work of the Center for Victim Research is funded by a grant from the Office for Victims of Crime, which is part of the Office of Justice Programs at the U.S. Department of Justice. The Center is a one-stop resource for victim service providers and researchers to share information about new research, research questions, evaluation tips, data that can inform victim services, and it is a partnership between researchers and practitioners at the Justice Research and Statistics Association, the National Center for Victims of Crime, and the Urban Institute. And now it is my pleasure to welcome today's presenters. Elizabeth Snell is a Senior Policy Associate with the Maine Statistical Analysis Center located at the Cutler Institute of Health and Social Policy at the Muskie School of Public Service at the University of Maine. Since 2015, she has directed gender-based violence research and evaluation projects following several years in victim services. Joining her is Pam Morin, Executive Director of the Family Violence Project. She has worked in the human services field for over 30 years. Pam has a long career in social work services with numerous intersections with the Family Violence Project before she became their Executive Director. Elizabeth and Pam are joined by two staff of the Family Violence Project, Melanie Beaulieu, who serves as the Shelter and Housing Program Director and brings a special expertise regarding Indigenous women and children, and Nikki Courier, the Housing Navigator. And now, I'll turn the presentation over to Pam Morin.
There you go. Yeah. Hello and welcome. I'm going to start and talk a little bit about Maine State Housing, which is the partner that we use in our rapid rehousing program. The mission of Maine Housing is to assist Maine people in obtaining and maintaining quality, affordable housing. And carrying out its mission, Maine Housing provides leadership, maximizes resources, and promotes partnerships to develop and implement sound housing policies. We work with Maine Housing through the Emergency Shelter and Housing Assistance Program, which provides funding to assist people who are experiencing homelessness or are at risk of homelessness. Family Violence Project is a private nonprofit 501 organization which is supported by Maine Department of Health and Human Services, Maine State Housing Authority, and the United Ways of Kennebec Valley and Mid-Maine. They are also members of the Maine Coalition to End Domestic Violence and the National Coalition Against Domestic Violence. On February 21st, 1978, a small group of women in Augusta area signed the Articles of Incorporation for Family Violence Assistance Project. In Maine and across the country, activists were mobilizing to create a safety net for victims of domestic violence through provision of comprehensive direct advocacy with and on behalf of survivors. They sought to educate and inform of the needs and the critical problems of battered spouses and of the social forces and attitudes which contribute to the problem. Over 40 years later, we continue to do that work. Our efforts are supported by strong coalitions and committed individuals. Almost 50% of homicides in Maine are those perpetrated by a current or former intimate partner, dating partner, or family member. Safety and peace in our homes is possible, and we believe it will take our entire community to make this happen. The services that we provide at Family Violence are, we have a 24-hour helpline. We provide individual advocacy work, including court advocacy. We have support groups. We have shelter and supportive housing programs. We have prevention and training programs, children's work, and we also have men's work, a program that works directly with abusers who want to change their behavior. Somerset Healthy Recovery House is the program that we were doing an evaluation on, so I'll tell you a little bit more about it. Somerset House is a domestic violence shelter for women with addiction and their children. And I say women because at this point we typically have been, women have reached out to us and we have served them in the shelter. We provide comprehensive supports for clients with complex trauma histories and extensive involvement in the criminal justice and child protective systems. The approach is relationship-based and staff-intensive in the short term. But like recent findings with healthcare super utilizers, this shows early success with complicated clients who historically have not responded to intervention. Family Violence Project Somerset House began with the recognition that we were not sufficiently meeting the needs of battered women with addictions in our shelters. Initially, we set out to address these needs specific to domestic violence and addiction. We quickly realized that each client we serve has a specific set of needs, and that it's essential to address many of those needs simultaneously for her to establish a safe and healthy life. Homeless shelters address issues around housing. Community mental health agencies address mental health and substance abuse issues. Physicians address medical issues. Welfare agencies address financial needs. And child protective services focus on the well-being of children. While each of these systems set out to support clients, navigating those systems concurrently is often beyond the capacity of any person in crisis. The advocates at Somerset House are with women while they negotiate these often complex systems. Somerset House is a small program. We serve 5 victims and their children, and we have 11 total beds. Our size allows us the flexibility to individualize services and to address the complex needs of each of the families we work with. For 5 years prior to the beginning of the Somerset House, Family Violence Project ran a domestic violence shelter in the same current location, with procedures much like those in other DV shelters throughout the state of Maine. Women were frequently asked to leave the program because of drug and alcohol use while at shelter. We knew these same women often faced serious safety risks. They had no other safe places to go and no access to substance abuse treatment. A group of women who had been asked to leave the program because of drug or alcohol use were invited to participate in a focus group and explain to the advocates what supports would have increased the likelihood of shelter meeting their needs. Those identified needs served as the core for Family Violence Project's proposal to the Office of Violence Against Women to fund a pilot program to shelter battered women with addiction and their children. Somerset House partners with Kennebec Behavioral Health, a community mental health agency, to provide intensive outpatient substance abuse and mental health treatment. Relationship is at the center of all the work that we do with the women and children at the Somerset House. The atmosphere is home-like. Somerset House advocates appreciate how important respect, kindness, and humor are in creating an environment conducive to recovery and well-being. The women at shelter have complex needs. While with the women, while with us, women attend group focusing on financial literacy, parenting, domestic violence. They receive support navigating the medical system, addressing legal issues, establishing new healthy recreational interests, promoting healthy diets and exercise, as well as issues specific to an individual woman or family. All clients receive domestic violence advocacy, highly individualized intensive outpatient mental health and substance abuse treatment, transportation. Mothers with small children receive child care during treatment. We strive to provide the most effective interventions and support for clients. Trauma-informed interventions such as yoga and help women increase self-efficiency, tolerance for discomfort, and stress reduction. Advocates have established strong collaborative relationships with other professionals, such as clinicians, physicians, law enforcement, child protective services. These relationships are vital in helping women meet their personal needs. Maine Housing has the Emergency Shelter and Housing Assistance Program, and we now are working with them. ESHAP consists of three shelter components and funding components, and they are shelter operation shares, which is available to agencies that have a fixed facility, rapid rehousing long-term stay and stabilization share, which is available to agencies that provide the navigator housing, which is what Nikki is doing at this point, and incentives and performance shares, available to agencies as an incentive to achieve specific performance measures. In addition, Maine State Housing also provides rental subsidies. Rapid rehousing is considered the best practice when serving homeless persons. So the question to us came up, yet we wonder if, because of the complexity of the people we serve, does rapid rehousing, is it the best practice for those coming into Somerset House? And so now I'm going to turn it back over to Elizabeth.
Yep. Thank you, Pam. So you'll want to just drag there you go, perfect. Okay. So thanks so much for being here, everyone, and thank you to my colleagues at the Family Violence Project who have been such wonderful partners throughout this project. Before I dive into the other half of the coin about how we supported Family Violence Project and Somerset House staff in building a framework so that they could answer their questions, I just want to share, please know you're welcome to ask questions in the chat box anytime. I want to pause here and see if anyone wants to ask questions of FVP staff. And know you can also feel free to interrupt at any time as much as we can. I'm hoping that this can be, you know, a virtual discussion. Okay. So, like Pam said, when they came to us, we tossed around this research question, right, which is for DV survivors who have multiple needs, who may be working to become free from addiction, who are still building all kinds of various supports. When or how soon should they be transferred from emergency shelter to permanent housing? And when they came to us with this question, to the Maine SAC, this is where the partnership began. This is a process that we replicate with other agencies who are also interested in program evaluation. And our ultimate goal for Family Violence Project is to be able to evaluate programming in the future, right? Not just this one-time evaluation of Somerset House, but that they walk away from this with some demystification around evaluation and an understanding of how it can help them improve their program design. Before I dive into it though, Pam, Nikki, Melanie, we've got a question from Joshua Brown about how you encourage your Somerset House clients to attend classes. Does one of you want to speak to that before I get going? I think that means you'll have to unmute yourself.
Yes, sure, we will. So I think one of the things that we do is we've built it into our, like it's the part of our framework. It's not required. You know, people who come into the shelter, they'll know that that's part of the reason behind the work that we do. And so it's built into a schedule. We provide as much of the supports to meet that individual's needs. And I would say for the most part, people do participate.
We frame it as an expectation that, you know, we expect you to buy into the program and attend the groups and participate fully in goals. And they do. They learn a lot.
But I also think it's important to know that it would not be a reason that we wouldn't, once somebody comes into shelter, if it turns out that the particular programs that we have in place are not working for them, we will look for other programs that may work. We still want it to be, the program is based on people who are dealing with addiction as well as domestic violence. So.
And we give them that language before they even come in. We talk about what the programming looks like. So part of their decision on coming to shelter is based around what they know we provide to them.
Did that answer your question?
Joshua, if you want to use the chat to let us know, that would be great. We have a few more questions specifically about your program, FVP, if you want to tackle those.
Sure.
It looks like Riley is wondering how long a client has to be substance-free in order to be eligible for a rapid rehousing voucher in Maine, in your experience?
Well, they don't. I mean, they don't. I mean, for the most part, people coming into our shelter are coming in, probably they might have used the day before, but they're coming into our shelter because of domestic violence and addiction. And so to be eligible for rapid rehousing, that is not even, that's not a question. Like that doesn't.
They can begin working with Nikki the day they arrive.
Right.
And Nikki's the housing navigator who's helping them sort out where they're going to go after Somerset House.
But it wouldn't even be a question that would make somebody not eligible for rapid rehousing.
Yeah.
Part of the purpose of rapid rehousing would be you would put somebody into housing as quickly as possible and provide all of the supports in place once they're in a stable home.
The women who leave our shelter generally leave clean and sober because the treatment that's attached to the program when they come in, they're able to maintain sobriety, usually while they're with us.
And I think that that's why we were kind of doing this evaluation.
Mm-hmm.
We were trying to figure out that what makes the most sense for the people that we were serving. Is it better for them to stay in shelter longer as we work through some of the issues with them, or is it better for them to be housed quickly and us support them with making sure that they have a strong support after they leave shelter?
I think what we should do, since we're still early yet in our hour-long webinar, is field a couple more of these questions because they're really good ones. And so why don't we say, till about 2:30, 2:32 or so, that we can go through this chat box and because folks want to hear from FVP and so do I. Let's go back up a few. Henry asked, and you have answered some of this, are there qualifications survivors have to meet in order to transfer to rapid rehousing?
Basically, the only qualification is that they need to be willing to meet with me. We do an assessment that helps us determine what is best for them as far as if they should have supportive housing or rapid rehousing, or if pretty much they really don't need my assistance. That's the only qualification. That and writing out, we do it's called a stability plan. We make goals. If they're willing to work on those goals and work with me, then we're set.
Right, and there is some, there's some eligibility like making sure that people have their birth certificates and, that sort of thing. And we walk people through that, and that's part of the work that Nikki would do.
And that's with any housing voucher program.
Right.
Great, thank you. So Joyce is interested in hearing more about the information you got from the former residents. You said you'd done a focus group with them and asked them about what would have increased the likelihood of shelter meeting their needs. What were some of those needs?
Right, so the majority of them talked about having easy access to treatment. At the time, many of them would come into shelter without any kind of health insurance, or at the time in Maine, though that's now changed. People that did not have children would not necessarily qualify for our Maine Care or Medicaid program. So there was that. It was also lack of transportation. It was for people who did have children. It really was lack of child care. It was having a stable, safe place to be. And all of the people that are coming into our shelter are also dealing with domestic violence. And so that safety was crucial. But yeah, I would say you guys have.
Yes.
Thank you.
That's part of the reason that our program is framed in that way. I mean, treatment happens in one way or the other 5 days a week.
So along that vein, Rebecca asks if Somerset House has a drug counselor on site, or do you refer out?
We actually have, we refer out, and one of the things that we found was that at one point we had a contract with a provider that came into shelter, and that really just didn't work. In our experience, it didn't feel like it was, I don't know, safe, or it just really wasn't conducive to treatment. So we then decided that we would take them out to the provider, and we would provide the transportation. So that was part of what we did. And in some cases, if the particular provider that we've set them up with isn't a good fit, because that's what happens sometimes, we then can utilize other providers.
Great, thank you. So Riley raises the question, just clarifying, what happens after somebody leaves Somerset House? Do they receive continued support from the housing navigator, and how long does that support extend?
It extends up to a year, but of course after that they're always welcome to access Family Violence Project for any of their domestic violence needs. Usually there's, well, I individualize it. Some women just want me to check in with them every 30 days. Every 90 days we do a review of their goals and write new goals for them. Some women would like to see me more often, and I do it. I have a couple of people that I meet weekly, and then there's some that it may be every 30 days I give them a phone call until the 90-day review is due, and then I'll go over to their apartments, meet them at their apartments, and write new goals.
And part of Nikki's work is also to ensure that people stay stably housed. And so it's a good way to really, you know, like if somebody starts to get into a financial situation where they can't pay their rent, that's something that they can work with Nikki on. And so it really is part of making sure that they can stay long-term in their home.
We don't, Nikki doesn't only use local landlords. We also have 7 supportive housing units that are attached to our agency.
Rebecca asks how long folks can participate at Somerset House.
So we don't actually have an end date for people. That really truly is based on the individual needs. Once again, it was part of the reason that we started to have this conversation and to do this evaluation because, you know, we had people that have stayed up to a year in our shelter. And that's not necessarily been a good thing for people, but does it make, like, so that's really been the question. Should we prepare people to leave shelter sooner, or is it the long-term in-shelter stabilizing? But we don't have, it really is based on individual.
Few more questions, and they're still really good ones. Kristen asks if Somerset House shelters active users alongside those in recovery and how you might address that.
Okay, so they are so people will use while they're in shelter. They are not active users. So when they're coming into shelter, it's with the understanding that they want treatment, because this is part of what we're able to provide. And so on a regular basis, if somebody were to continue to use, and that would not make sense for them to stay in our shelter.
And that's based around the concept of safety within our shelter. Women are not always asked to leave if they use while they're living with us.
Thank you. Let's just do one more question. How about, I'll speed through my slides, and then I want to make sure we save plenty of time because this is just such a great conversation. But a few logistical ones. Is there an age limit for children who enter, or number of children who enter with their parent?
An age limit, no.
Or number of children?
As long as we have space for them available when they have to come in, they can bring in their children regardless of how many there are.
Right. And then a question for Nikki, and obviously for Pam and Melanie too, but how do you make decisions regarding housing readiness? Is it program staff, or is it the survivor, or a combination?
Well, we do the assessments.
It's called the VI-SPDAT.
Yeah, and as far as readiness for them to leave the shelter, that's again the question that we're trying to find out the answer for.
Right.
But usually, if there's vouchers available, within a month or so, I start looking at would they qualify for the voucher? Make sure that we've got the necessary documentation, the income, the Social Security cards, and stuff like that. Usually we play it by ear. The clients will tell us, I'm ready to leave, or more than ready to leave. And It's determined by what voucher, how quick they can get the voucher, and finding apartments. That's always the challenge, is finding the apartments. So they may have been able or felt able and eager to leave a month ago, but we still can't find an apartment. We just keep doing what we can, and it seems like the right apartment comes around at the right time.
Yeah, and we also try to do like individual safety and recovery plans and individual transition plans. So it's really always based on the individual needs. That's part of the trauma-informed work that we try to do.
Although rapid rehousing is all about getting them housed as quick as you possibly can, the way our program is set up, by the time they get into an apartment, they usually have most of their resources already wrapped around them. So the transition is usually pretty smooth.
I will use Gretchen's question to transition into more about the evaluation framework. And then again, we can pause and we can answer more questions at the end. So Gretchen is asking a little bit more about sort of the context around the program. Do you find you have to turn people in need away? And are there other programs like Somerset House in the area?
So yes, we have to turn people away because we only have 11 beds. And what we try to do is make sure that we're not bunking people together as much as we possibly can. So each family has their own space. So yes, we are definitely turning people away. There are not a lot of programs in Maine that provide both treatment and services for domestic violence survivors and victims. I think we're about the only one. What we have seen happen, though, is that because of the work at Somerset House, a small amount of money has been provided to all the shelters in Maine to look at ways that they can provide support around addiction within the framework of their shelter. And I know that we've now been able to duplicate some of the programming, not all of it because it's, there's a different funding source, but we've been able to produce it in some of our other shelters.
And historically, Family Violence Project has always worked with probably close to the same number of women with addictions. The only difference between how we did it before when we only had the one shelter and how we do it now with Somerset House is that it's identified and there's a program set around it.
That's a great point. And I won't bury the lead. I mean, we think this is a wonderful program. And as Pam said earlier on, they are seeing some real anecdotal success. But we want to get the word out about Somerset House. And when I'm sure that so many of you on the phone have experienced this, when you're wanting to sound the trumpet and share an innovative new approach that's trying to do things differently, that's showing some real early success, most funders I know, the next question is, well, show me the data. So that's where we came in. So the Maine Statistical Analysis Center worked with Family Violence Project, the way that we work with a lot of different community-based agencies, to assemble a program evaluation framework that included various tools so that they could tack back to this question: how do we know if what we're doing is successful, and when or how soon should survivors be transferred? So I'm going to go over, I'm going to model for you some of the evaluation work that we did with Family Violence Project for a couple of different reasons. My first one is, as a former advocate, I used to work, my office was in the attic of a shelter. evaluation was this mystical, mysterious, and intimidating term to me. And when my career path changed and I came into it, I was like, oh, this is what they meant. And so our goal here at the Maine SAC and at the Cutler Institute is to really support community-based agencies who are interested in becoming more data-driven, understanding more about their data, and how they can really be using it to best allocate limited resources, right, or seek additional streams of funding. We think that one's a really important one. So what I'm going to do, again, is go through some of what we did with them and offer you some resources to think about how you might add a little program evaluation in there in the hopes of understanding if what you're doing is accomplishing what you hope it does, and then how you might be able to use it to grow. Before I get started, I would love to see using the checkbox, the yes, and then the red X for no that Susan talked about before, whether you have ever worked on any program evaluation before. So if you want to go ahead and move your mouse over yes, that's the green check mark, and the red X is no. I'd love to see who's in the room and what kind of expertise we've got. And it looks like for the folks who are answering, we look pretty well evenly matched. Okay, that's good. So I may be saying things to you that you already know about, but maybe you'll appreciate the refresher, or maybe I'm helping demystify some of these, the intimidating words that you might be coming across in grant proposals. And the first one is what we mean when we say program evaluation. Basically, what I think that means is being systematic about how you're collecting and you're analyzing and reporting out your program information so that it can help you with decision making. Again, as I said, how will you know that you are successful? And I should say, before we get too far into this, we don't, the Maine SAC and FDP don't actually have enough information yet to actually answer FDP's question. So rather than keep you hanging till the end of the webinar, I'll tell you that right now. That is a big limitation of this project. But as I said, we have a lot of anecdotal examples of success here, and now FDP is in a great place to take this forward in the future. So before I get really started, I just want to thank a number of our colleagues. We have a wonderful set of partners at the Maine Department of Health and Human Services, Heather Tyler, who is our VOCA Administrator, our colleagues, of course, at the Center for Victim Research, our absolutely dedicated and courageous advocacy colleagues in the field at Family Violence Project, and then the Data Innovation Project, who is right next door to us, one door down from me, which does this kind of work with many agencies around Maine and across the country. So the first pieces that we tackled first for Family Violence Project were a theory of change and a logic model. Now, how many of you, again, using that checkbox or that no mark, have ever heard of a theory of change before? You can mouse over it. Seeing a couple of checks and a couple of no's. Okay, so when I think of a theory of change, this to us is really the place you want to start if you're interested in learning more about whether or not your work is successful and if you want to strengthen your program design. We think of this as the broad brush strokes. It includes this root cause analysis, right, which takes into consideration the research, best practices, assumptions around your work, and you can use it then to shore up a program level logic model, which is sort of the roadmap, right, that's really getting specific about your strategies. And we see these as two great tools that can help you measure what you're doing and help tell your story out to the field or to funders. So let's start quite quickly going through a theory of change. This is a three-parter, and it describes what you're hoping to see change regarding a specific condition. So the population level condition you're trying to address. And for Family Violence Project, right, they're thinking their population is domestic violence survivors with co-occurring addiction issues. And their vision, right, is that they live in long-term, stable and secure and sober housing. Now, once you've done your results statement, then that's when you can build in the root causes, all of the various reasons why or contributions to, maybe barriers to achieving results, or maybe strengths, right, that could support and improve and get closer to the result you want to see. And then the last piece of it is your strategy, aka your mission. So what are the things that are specific and measurable that you are doing to address those root causes to get to the result you want to see? So, as I said, we started at the top with the vision, and Family Violence Project articulated their vision, which was this right here: DV survivors with co-occurring addiction issues will live in stable, secure housing free from violence and addiction. So it's specific, right? It's measurable. If you've ever heard of SMART goals. Then together we tackled the root cause analysis, and this is what Pam and Nikki and Melanie are encountering every day, right? This is what they already know about why are they needing to provide this wraparound support to these specific DV survivors? What are the problems or barriers that exist? And so I'd love to pause here and see if anyone, by using the chat box, wants to guess at some of the root causes that the Family Violence Project through Somerset House is hoping to address with this holistic wraparound support and shelter model. Just brainstorm. Can you throw out a couple? Well, looks like I'm not getting any takers, which is okay. So let me, Susan has one. Thanks, Susan. Yes, this is people with addiction often don't qualify for housing. Rebecca points out a lack of credit, lack of employment. Armani is sharing employment issues. I also think about maybe the lack of training for employment. Catherine points out a big one, right, which is systemic oppression. And Patricia points out the fact that we know that survivors may have higher rates of depression and anxiety based on trauma. Jamie is pointing out family history, Carla, systemic racism, Alita, understanding the cycle of abuse. Yes, these are all exactly right. And Jeannie points out the experience of DV victimization contributes to addiction, lack of money, or having a record. These are all excellent suggestions. Legal issues, drug charges, staying safe. These are all things that we thought about Family Violence Project and the Maine SAC when we were putting together why are survivors experiencing setbacks or relapsing or struggling to maintain housing. You have shared just about everything that we've put up here. So once we had our root cause in place, then we focused on moving from mission to vision. We were then looking at what are the specific interventions that FVP and Somerset House are putting into place that are addressing those root causes that are preventing them from getting to the results statement they want to see. And so this is where, again, the more specific you can be, the who, what, where, when, how, again, that's the SMART goals, the better. And so I'm gonna share a couple of the strategies that Family Violence Project staff came up with, are basically articulating what they are already doing. As Pam said at the start of this webinar, FVP and Somerset House staff prioritize relationship above all. They are, as Pam said, this is intensive work for their staff, but they have a hunch, right? They're seeing anecdotal evidence that by creating these individually focused education plans, these goals that Nikki talked about, ensuring that the care that they're receiving is trauma-informed, connecting community partnerships, connecting folks to recovery, they believe that by doing that, they're going to meet their mission. And so, again, if you see it all together, basically, the theory of change for Somerset House is that domestic violence survivors, or actually what I should do is turn to the next slide. This is a great little sort of check yourself statement that my colleagues at the Data Innovation Project use all the time. They flip the theory of change backwards to make sure it makes sense. So if we do X so that Y happens, does that result in the changes we want to see at a population level? And let's see if it checks out for Somerset House. And the spoiler alert is that we think it does. So if Somerset House staff and Family Violence Project do all of those strategies that they talked about, put relationships first and provide these wraparound services, we believe that the root causes will be addressed and that survivors will be experiencing fewer setbacks and fewer relapses, so that Family Violence Project vision will become a reality, so that survivors with co-occurring addiction issues have the opportunity to be in stable, secure housing, free from violence and addiction at some point. And so we believe this theory of change works. And again, I'm going quickly here. But now we need to figure out how to confirm that, right? And so that's where a logic model can help you get really specific about how your program strategies are addressing the results you're seeking. This is where you can start tracking your progress towards the impact you want to make. And often for a logic model, it's easiest to start at the bottom, to start with what is the long-term population level change I want to see, and then work backwards to fill in what you're going to need to get there. So I will go very quickly through this is a little screenshot of a much larger logic model that Cutler, Maine SAC, and Family Violence Project staff put together. And again, as I said, we started at the end. We were looking for long-term population level changes. Now, for Somerset House, we decided together that long-term outcomes for them meant a year or a year plus. And part of that is what Nikki mentioned, right, that she can work with folks for a year after they leave the shelter. She will always work with people if they contact her. But we're looking at about a year out. And so the vision here could be by survivors remain free from violence, remain sober, remain active in community, they remain stably housed. Now, FVP and Somerset House staff have the least amount of influence over this, right? Because this is the longest term outcome and this is population level. So the closer you get back to short-term outcomes, the more influence your program's going to have over this. So if you're looking at these intermediary outcomes, these are more like behaviors or practices or systems. This is what Somerset House staff is looking for in the first 3 to 6 months they're working with folks. Maybe this is survivors report that they've learned decision-making skills and that they're applying them in the field. Maybe it is that survivors report that they're regularly attending peer recovery groups. For short-term outcomes for Somerset House clients, this is all about knowledge, skills, perceptions, changes that Somerset House staff is looking to see in the first couple of weeks or months. Women report that survivors feel safe, that they are showing up for one-on-one chats or periodic check-ins about goals. They're beginning to build those relationships. And now we switch from outcomes to outputs. And this is a place where a lot of people we work with get tripped up. For one thing, they sound the same. But the way I think about these is that outputs help you quickly tell your story. Outputs are how many, how much. So how many times, how do you know you're doing the work? How many times did Somerset House staff provide transportation to a peer support group or to the case management that's off-site, or sorry, the substance abuse counselor? Your outcomes then are helping you understand what you're achieving on a bigger level because of your activities. So if your outputs confirm for you, like, yep, we are doing the work, we are doing the activities that we said we would do, your outcomes are helping you get a better sense of, are you getting closer to actually seeing some changes because of your program? So if we keep working backwards, your activities and your inputs are often the easiest part of your logic model, right? Because activities are what you are doing to implement those strategies, all of the different linkages to community partnerships, the monthly individual reviews, the groups, providing transportation. And your input could be as broad as personnel and volunteers, the funding that you get, the facilities you have, the vehicles you use to transport folks. So at this point in our partnership then, Somerset House staff have got this great theory of change that they came up with, and they've got a great comprehensive logic model. And you can see more about this in a longer report we did, and I know that CBR will send those materials out. But this is getting closer to answering their question, right, about in the long term, how will we know when a domestic violence survivor with co-occurring addiction issues should move to long-term housing, and whether or not rapid rehousing is the right approach for this. They are getting closer to learning that, right? But they're still needing to actually figure out the ways that they're going to measure whether these programs and services are having an impact. And this is where it can get really tricky for folks, because it can be sticky on what exactly you should be tracking and measuring and how should you be doing it. So we didn't stop there. The next thing we did was go through the process of a data inventory with family violence staff. And this allows you to take that logic model and match your outputs and your outcomes to metrics. So it makes it easier for you to say, okay, if these are the outputs and outcomes I want to track, how can I figure out, am I already measuring this? Like, is this in a spreadsheet that I already am required to send on a quarterly basis to this particular funding agency? Do I have open-ended paper surveys that are like sitting in a file in my locked file cabinet already? And what are you missing? So that if you are wanting to really track a particular outcome, what questions do you need to ask that you maybe want to modify somewhere? So be thorough. I mean, this might be attendance reports or enrollment forms or one-on-one interviews. This might be in your grant reporting reports that you have to do. You might even look on a larger scale to surveillance data or your donor database. And so this is what a sample in data inventory might look like. And we've included just a couple of the many, many different outputs and outcomes, right, that are on that larger logic model. So we went through this inventory of what did SVP want to be tracking, how we might turn it into a metric. So if a short-term outcome of your program is that you want survivors to feel safe, then you need to be tracking the number of people who are feeling safe. And very quickly, you're able to see from the source information that either it's already being collected or it's a question that we need to add to a couple of different opportunities for surveys. And I just want to pause here. We've just got 3 minutes left, so I'm going to go really quickly through the various surveys that we helped Somerset House expand. And the last thing we did for them was to help them put together a data dashboard, which sounds fancy, but what this really is just a place where they're able to track this in one place and store this data in one place. So on the back end of this, and it's basically in a sort of a sophisticated Excel document, they can input data from their database or from these surveys that we modified, and then on the front end, there are some simple visuals that will automatically populate so that they can analyze and display the outputs and outcomes they're interested in, and all with that ultimate goal, right, of knowing whether or not their program is doing what they want it to see. And these are great because you can pop these into newsletters or grant reports or grant proposals. So the last thing I'll say is that as with any project, of course, there's limitations, right? We've got a small model, as Pam and Melanie and Nikki mentioned. There's not a tremendous number of devs. And a logic model and a theory of change, this is a time-consuming process, right? And so even though we took 6 months to put this together, it could have benefited from more time with more staff and more stakeholders. And then the other thing, of course, which you all know from working in the field, participants aren't always reachable after they leave shelter. And this could be because of positive changes in their lives, or it could be negative. We just don't know. So I leave you with a really hopeful and optimistic framework that puts FVP staff in a great position to be answering this question along the way. We're not there yet, but I think we're going to be. I'll pause there, and I will open it to questions, either for me or for anyone else, for any of the FVP staff.
Thank you, Elizabeth. I'm sure we have a lot of questions out there. This has been fascinating. Folks, we will go ahead and open up our exit poll just so it's there when you need it. But feel free to put your questions in the chat box, any questions about this formative evaluation, and I'll start. So, Elizabeth, what are next steps now that you have the theory of change and you all have, Somerset House has changed some of their questionnaires to start gathering information?
So, great question. Next steps, Susan, are to start using the surveys that we put together and the questions that we added or suggested adding to some of those one-on-one monthly conversations, and to start inputting them into this data dashboard. We're not going to be able to really know anything until we have a little cohort of data in there. And let's see, I'll quickly answer Amelia. Yes, the data dashboard is just Excel. And if you Google data dashboards, or if you look at my at the resources at the datainnovationproject.org, you can find some great examples of these. Jeannie has a question, or Janine has a question for Family Violence Project about complicating factors. What are some of the complicating factors? Well,
such as batterers, ongoing abuse, or stalking, or what happens when funding for the survivors' housing runs out. Family violence staff, do you want to take a crack at that? Those are certainly some of them, and I think there's a multitude of other complicating factors.
Sorry, we were having a hard time opening back up from being muted. So complications, well, as far as like the subsidy ending, that is really not something that happens right now in Maine. The subsidy lasts as long as the need is there, or the eligibility is in place. So we have not had that limitation as of yet. Doesn't mean that it won't happen. And as far as the issues around domestic violence, we would deal with that in the same way that we would deal with anybody that we work with. So if that particular, let's say somebody moves into an apartment and their abuser finds out where they live, that could be a reason for us to relocate them. It may be, and their subsidy could potentially go with them.
We would safety plan the same as we would with anyone, just a random person calling our helpline too.
FDP colleagues, Erin is asking a question about what type of curriculum do you use for Somerset House participants regarding DV and SA?
So one of our employees has created a DV 101 handbook. It's something that she just put together, collected the information, and has worked very well for her for several years now. I don't believe it's anything that she's purchased or anything that's been taken from another agency.
And we also provide a curriculum called Seeking Safety and Living in Balance, which are both provided to all of the survivors that stay in our shelters.
Right, and that's administered by Kennebec Behavioral Health, who's our partnering agency around addiction and mental health.
We also use a curriculum called Rent Smart that was developed by the University of Wisconsin that teaches basics on how to be a good tenant, how to develop budgets, how for appropriate apartments. You know, what are your priorities when looking for an apartment? Is it something that's going to be in a rural area because you want to have pets eventually, or is it something that you need where there's public transportation?
Thanks, Nikki. This is a great question from Rebecca, and I'm directing it to Nikki because I think you might know the most. Do you have any anecdotal information on the success rate of folks staying in housing after they leave shelter and after funding ends?
Just off the top of my head, I think we have very good success rates with that. What's that?
Yeah, I was going to say the same.
Yeah, very good success rates. I still keep in touch with people who have graduated the ESHAP program. They're still in their apartments. Many of them have started going to school. So having a navigator for these clients has proved to be immensely helpful for them.
And I would say that, you know, I'd say probably, I'm going to do this anecdotally, so I'm not positive, but like it's 70% are still receiving some kind of support from us and the Kennebec Behavioral Health. So, yeah, and stay in touch with us after the year.
That's great. Sarah has a question about Veterans Affairs. Have you thought about partnering with them, since I'm sure you work with female veterans?
We actually have partnered with them, depending on the individual needs.
Yep.
Yeah. And there are some housing subsidies that potentially could come with that.
That's great. Rachel is from West Virginia, and she works for the Crime Victims Compensation Fund. She was asking whether or not you reach out to your state's fund for assistance for the victims, like relocation costs, or does the CV fund play into helping with this particular program at all?
We have utilized that fund.
In both shelters.
Right, yeah. And there have been a number of different ways that's been available. Sometimes housing, sometimes some of the other barriers that it really is based on the individual needs, but we've had great success.
Rebecca has another great question about whether or not you at Family Violence Project work with human trafficking survivors that might have the experience as well.
Yes, we do.
Yeah. A high number of our clients in the past few years have been survivors, yes.
Yeah. And one of the things that has happened is that in Maine, there has recently been an opening of a domestic violence shelter specifically for victims. And much of their work and their programming is based on the work that we had done at Somerset House. We've actually were part of their planning. So.
Yeah, and it's quite new, right? I think it's about a year or so old.
Just barely a year. Yep.
Yeah. And so from our standpoint, from the research and evaluation side, we're really interested in supporting that house however we can and helping them with evaluation too, because as you can imagine, there's lots of questions about best practices there too. Yeah, one to watch.
Yes.
Rebecca has another question about do you actually have programming for human trafficking survivors, and have you found that to be difficult?
We did not have separate programming. We utilized the same program that we used for everyone, and it was positive. Our numbers are very low, so I would say we probably in the 5 or 6 years that I've been there have worked with maybe 6 or 7 trafficking victims, and we've just utilized all of the same programming that we utilize for everyone.
Good agencies who deal with survivors as well, we work closely with.
Thank you. Elena's got a question about behavioral health providers. So does Somerset House partner with any behavioral health providers? And if so, how do you approach that? Do they bill the survivor's health insurance, or if they don't have it, how do they cover the cost of behavioral services?
Right. So one of the benefits of having the OBW funding is that we were able to provide the funding for anyone that didn't have health insurance. What has been really great, and we have an agreement with Kennebec Behavioral Health and another agency, because what we realized is we didn't want to limit it to only one provider, because sometimes other providers work better. So we have agreements with 2 at this point, and we'll utilize other providers as well. What did happen is that in Maine, the Maine care has been expanded so that most of our people do receive Maine care, and when possible, the Kennebec Behavioral especially will bill for whatever Maine care is able to cover, and will invoice us for things that they're not able to cover.
Because there was a time for several years when Maine care was very difficult for women without children to receive.
Right.
And at that time, we were able to provide services that were not available to them, I think, anywhere else.
Right.
Riley's asking about how have you provided support for folks who may be from the LGBTQ population?
In the same way. I mean, you know, people come into shelter if that's the right fit for them, if there's an addiction. So we've provided the same programming.
And we provide services for any person identifying as a woman.
We've come to the end of our questions. We're happy to field a few more if anyone has any.
All right, while we're waiting to see if anyone has any additional questions, please do remember to take that exit poll before you leave.
Do you want to put that up again, Susan?
Sure. Folks, if you look at the bottom right of your screen, you'll see that there is a way to open polling. It appears under the chat box.
There it is. Let's see.
Elizabeth, Pam, I think that is the end of the questions. I want to thank you so much. I think we have all learned a lot about the potential for this type of programming and for researchers to partner along with us as we develop new systems to make sure that we are providing the best care possible.
Thank you.
Thank you. Thank you all.
All right. And folks, one more time, we will be sending out a link to the recording, to the PowerPoint slides, and to some additional resources. Thanks for your participation today. Goodbye, everyone.
Bye.
Bye.
Bye.